A lot of times we have people who look like us who are part of systems
Okay.
who sustain those same systems, right?
I know.
We have the delusion of inclusion, right?
Mm.
Right. So so the question that I asked initially was not that we have a legitimate reason to distrust the system. We do, right? I think we can agree to that. But what have you seen that's changing in the system that you can articulate to say that, they are trying to do better?
When I came to Maryland, I'm gonna tell you the truth. I was lost. I was a little bit of a lost soul, a lot of it. Wasn't really sure about whether this is the right path for me or anything.
Mm-hmm.
But what it really took was someone who looked like me to say, you have a responsibility to your community to do better and to do something different. And no, you cannot exhibit that same systems level behavior in which you were trained. Because I was at UCLA,
Mm-hmm.
the system, and with the Hopkins, the system.
Tormentors.
Right. And so it was put on my shoulders that I had a responsibility. So I see that. I see it with Dr. Wilson and Dr. Thomas, who I'm talking about, and Dr. Fryer and all of we call ourselves agents of change.
There you go.
So we have a whole little posse of faculty at University of Maryland, and we are the ones, we stand up to the dean, we go to the dean's office, we're like, this has got to stop, et cetera, et cetera. So again, we're a communal culture. That's what we do, right? So what we do is we build our strengths by bringing in the people and saying, we got to do better. We cannot replicate the same stuff that we know is going to end us in the same place, Black people. And so it's tough because the system is a system. And so the people that are like at the higher ups, they all look the same, right?
Right.
I'm the only Black epidemiologist in my entire department. The only. So that means I get all the Black students, all the Black people. Everybody want to work. I'm just like, I'm smoked, I'm tired. But I have a responsibility to them so that I can show them it is your job to go and do the work that you need to do and to not exhibit the systems level behavior that is going to result in the oppression and this continued shackling of Black people mentally and emotionally and spiritually and physically. And our health is a manifestation of all of that generational trauma, and we haven't healed yet.